My name is Pratheesh Sathyan. I lead the medical affairs team for oncology at Illumina. Illumina is a genomics testing company. So we are the global producers for genomic testing equipment all over the world. So our equipments are mostly used for all genomic sequencing across the world. Yeah, so we are in an exciting time for lung cancer treatment at this point. I mean, we are moving far away from the traditional treatments, which is chemo and radiation, to the personalized medicine. That means every patient gets something which is very personalized for the treatment. The first step for that kind of a treatment scenario is to make sure that the patient we identify the right alterations, which is actually driving the tumor. So we are actually have medications which are very much focused on those alterations, and genomic testing is the first step to identify those alterations. And based on the alterations, the patients can be actually given medication which are only targeting those alterations. That is basically precision medicine. And that precision medicine approach actually reduces the comorbidities, like the side effects, the toxicities associated with conventional treatment. And that actually helps the patient have a better standard of care as well as quality of life during this, for lung cancer at this point. And we have seen probably 70% patients could have a targeted therapy option compared to the standard of care option at this point in lung cancer. So it's an exciting field, and things are changing every day in lung cancer, and it's becoming in the showcase place for precision medicine in cancer therapy. So long back we started to see that these cancer cells secrete out DNA into the blood, and we first saw that in pregnant women. When we were actually testing them for genetic abnormalities to see whether the kids have genetic abnormalities, and we started to see that these women had tumor DNA in their blood, and that led to an explosion of understanding what actually happens for these secreted DNA in the blood for cancer patient. And we have seen that in advanced stage lung cancers, you see a lot of circulating tumor DNA that's coming out of the cancer cells. So a draw of blood, which is liquid biopsy, can actually test for these alterations, which I previously mentioned for precision medicine, using a vial of blood to see what mutations are driving the tumor. So obviously ctDNA or circulating tumor DNA based testing is becoming a very common scenario, especially given that it's less invasive, easy to collect. It doesn't have to have the invasive procedures like going in and getting a biopsy from the tumor. So it makes it a lot easier to access the genetic makeup for precision medicine. Obviously, from a therapy response perspective, as well as we are getting into a space of minimal residual disease, where we actually can use a ctDNA based monitoring to see whether the patient is responding to a tumor or not. So there is a huge expansion in this liquid biopsy based treatment for cancers at this point, and the applications are widening. And today we have an opportunity to talk about liquid biopsy, its application, as well as the newest application of liquid biopsy, which is minimal residual disease. So this is a very, very exciting field where we have seen an explosion of opportunities. And also from a treatment perspective, this makes the access to tumor testing much easier, much global, which is one of the major interests for ICPC. So I feel like the interest in liquid biopsy and the applications we have seen in liquid biopsy really can drive the access for tumor testing across the globe, which makes it a lot easier in different countries across the globe. Yeah, so again, these are all sequencing-based technologies. Some of these technologies uses whole genome sometimes based on but that means you are looking at every part of the genome, or a targeted approach. So there is a lot of sequencing that's involved. At this point, over time, the cost have drastically come down. So if you think about it, 20 years back, when we actually first sequenced the genome, it was billions of dollars. Right now, it's in hundreds of dollars. So the cost has come down, but still there should be a lot reduction in cost from the newer technology that's being employed right now. That'll make the access. I think more than the cost, what really challenges some of these technologies for global expansion is the technical expertise that's needed. Because at this point, with a lot of these technical expertise are limited to uh, economically developed countries and economically developed centers, right? I mean, academic centers and, countries where there is abundant resources. But having said that, we as a company, as well as others in the space, are very much involved in kind of removing that technical expertise and kind of automating these technologies to make it sure that this could be accessed across the globe. So can we actually collect a blood and automate the processing all the way to sequencing is something which is actively being done across different platforms to ensure that these technologies could be used across the globe faster.